Hello, my name is Matt Curler, and I'd like to welcome you to this online webinar presented by Surescripts and the American Academy of Family Physicians. Today, we're excited to offer healthcare providers a simple, secure, browser-based clinical messaging portal that we call our AAFP Physicians Direct Clinical Message Portal. As family practitioners, you and your staff are undoubtedly dealing with a high volume of information related to your patients. Likewise, sharing that information with your patient's care team is most likely taking up a lot of your time, as well as the resources of your office. And that's where we can help. We'll be giving you a brief overview of some of the powerful features of the AAFP Physicians Direct Clinical Message Portal and give you a demonstration of its robust capabilities. We hope to provide you with a thorough understanding of how it can help improve your practice's ability to share vital health information, enable better care collaboration and coordination with your fellow healthcare providers, and improve the quality of care you offer your patients in a cost-efficient manner. We think you'll be impressed with how intuitive and easy the clinical message portal is to use. After that, we'll have about 15 minutes to answer your questions. So if at any time you think of something you'd like to ask, just click on the questions and answers box and type your question into the appropriate field. We'll try to answer as many of your questions as we can. Lastly, if at any time you do need help, simply click on the help button located at the bottom of the screen and someone will reply to your question as soon as possible. All right, we have a lot to cover, so let's get started. First, a little bit about Surescripts. We operate the nation's largest e-prescription network and support a rapidly expanding ecosystem of healthcare organizations across the nation. In fact, we have over 230,000 active prescribers sending 3 million e-prescription related transactions each day. With this type of industry leadership and expertise in sending and transferring health information, it isn't hard to see why the AAFP selected Surescripts to deliver this new web-based portal solution to its membership. Moreover, the portal supports the AAFP's vision of transforming healthcare to achieve optimal health for everyone, especially tools that better equip its members to meet the shifting requirements of healthcare. To get a better understanding of how the AAFP Physicians Direct Clinical Message Portal can impact your practice, let's first look at how healthcare providers are sharing care documents today and some of the significant challenges that are connected with sharing health information. According to a recent survey sponsored by Surescripts and conducted by the Kelton Group of over 400 private practice physicians in the U.S., over 69% of respondents still use either fax or regular mail as their most frequent way of sharing health information with other physician practices. What's more, physicians said they spend an average of 25 minutes a day sending and receiving health information for their patients, and their staff an additional 63 minutes on average. That's a lot of time faxing, mailing, and phoning. The survey also showed that 55% of physicians said they typically receive patient information after the patient's visit. Of course, this is less than ideal. And when it comes to EHR systems, 86% of physicians who are using EHRs still need to send health information via fax because their EHRs can't communicate with other EHRs. The takeaway from the survey was clear. Healthcare providers and their staff simply want to make sure the information they are sending gets to the right party quickly, reliably, and securely, and that their technology solution should make that communication process easier, not harder. This webinar is designed to show how the AAFP Physicians Direct Clinical Message Portal is doing just that. It's an intuitive and easy-to-use web-based clinical messaging application that enables you to securely communicate and share healthcare information with other providers. The Clinical Message Portal is enabled by Surescripts technology and built on our strength and experience as a trusted, open, neutral, and national e-prescribing network. Our network works with a variety of technical platforms and across EHR systems, so you can easily and securely electronically send messages and information to anyone, no matter where they're located, no matter what health system they're a part of, or what network they belong to. Recipients don't even have to be a member of the portal. At the end of this demo, we hope you will have discovered the many benefits of the Clinical Message Portal. That, 1, you can securely and electronically send a broad range of valuable health information to any healthcare provider with an email address. 2, the portal can support your efforts in improving quality, efficiency, and care coordination. 3, your information is delivered across a secure, reliable, trusted, neutral network. And 4, that you'll see how using the Clinical Message Portal can help you improve the continuity and quality of care that you can offer your patients. Lastly, we hope that you'll realize all of these benefits are possible with a platform that is very intuitive and easy to use. To show us exactly how it all works, I'd like to introduce you to Sarah Sheridan, who is going to demonstrate the key functionality of the AAFP Physicians Direct Clinical Message Portal. Sarah?
Thanks, Matt, and hello to all our viewers. Thanks for joining us. We are excited to support AAFP membership with the technology and the network that enables the AAFP Physicians Direct Clinical Message Portal. I also wanted to stress that one of our major goals with the Clinical Message Portal is to remove or minimize technology platform barriers to secure health information sharing. All physicians, regardless of their EHR environment, can subscribe to the Clinical Message Portal and send information to any other physician with an email address. The Clinical Message Portal supports quality reporting, patient-centered care, and continuity of care. It fosters a stronger relationship between the primary care physician and specialist in terms of coordinating patients' overall care. The primary care physician can use the secure Clinical Message Portal to help ensure the patient receives the right care at the right time. Now I'd like to show you how the AAFP Clinical Message Portal works. In this demonstration, I'm going to send a message from a primary care physician to a cardiology specialist. So I'm going to start off by logging into the first computer as the primary care physician, and on the second computer I'll show you how the specialist can receive the message, log in, and view the content as well as the attachments for the referral. So in this instance, I'm going to go ahead and log in as the primary care physician, who is Dr. Winston. He has a cardiology patient he'd like to refer to a cardiologist. In that case, the patient's name is Walter Caldwell. So to start off with, I'm going to go ahead and select a message template that I have prepared with all of the necessary information for the referral. Using message templates is an easy way to create messages and send them to referrals that you do repeatedly. So I'm going to start off by selecting Dr. Todd Brown, who's our cardiologist, from the list of providers in the directory. Once I've selected the provider, I'm going to go ahead and send a couple attachments that Dr. Brown would like to see for the referral. So in this case, I'm going to go ahead and attach several documents. I'm going to start off by attaching an EKG image, and I'm going to attach the patient's chart summary, and in this case it happens to be a continuity of care document or a CCD for this patient. I'm going to then attach a text document, which in this case is a recent stress test. Before Dr. Winston sends off his referral, he can also preview the images to make sure he selected the documents he would like to send. So in this case, he can preview the EKG. He can also preview the text document, which in this case is the stress test. And he can preview the chart summary or continuity of care document that's showing the viewer as an easy-to-read format, including all the pertinent information, including lab and diagnostic information. Once he's ready to send it, he can click the Send button, and it'll send it off to the referring specialist. Now I'm going to go ahead and switch screens and show it from the specialist perspective. In this case, Dr. Todd Brown is our cardiologist, and he happens to be using Gmail for his email. In order to maintain security, we don't send messages across the open internet. Instead, what we send is a notification link so that they can log in and retrieve that specific message on the Clinical Message Portal. So we go ahead, I'm going to log into Gmail as Dr. Todd Brown, and we see that he has a message waiting for him from Dr. Winston. So we'll go ahead and open up the notification message, and again we can see that we did not send the information out over the broad internet. Instead, we sent a notification link that will prompt the specialist to log into the Clinical Message Portal and retrieve that specific message. I'm going to go ahead and log in as Dr. Todd Brown. Once he logs in, he can see the message as well as the attachments that have been sent to him by Dr. Winston. So in this case, he can view the EKG, the CCD in the nicely formatted template, as well as the stress test. Once he has seen his patient, it is customary to send back a consult note. In this case, he can maintain two-way communication by replying to the original message to Dr. Winston and attach his consult note. So he can attach and choose files from his file system, and in this case I'm going to select the cardiology consult and send it back to the referring physician, which was Dr. Winston. I'm going to log out, and then I'm going to switch computers back so that you can see what Dr. Winston received and how Dr. Winston is able to easily track the message that he sent, see that it was received, and that the items were read by Dr. Brown. So we can see here that Dr. Winston has received the reply, including the consult note from Dr. Brown. He can open up the message. He can download, open up, and view the consult note, as well as track the life of the message. By going to his sent messages, he can see that one of one messages has been read. He can also open up the tracking tab and see that he sent the message, that it was received by the recipient, and that Dr. Brown was able to view the attachments. He would also know if the attachments were deleted or if the entire message was moved to a folder to be saved for later. As you can see, the Clinical Message Portal makes connecting and sharing documents with other subscribers very straightforward, efficient, and secure. Moreover, it has the flexibility to send a broad range of documents, including but not limited to discharge summaries, chart summaries, referrals, and immunization records. Messages are sent securely and can be easily tracked. This is clearly more productive than fax, regular mail, or phone conversations. I've shown you how a subscriber can send to another subscriber on the network, but you may be wondering how you can send to someone that hasn't signed up yet. In this instance, I'm going to show you how you can use the Send to Anyone feature to send to another provider or specialist using only their email address. That provider will be able to sign up on the network and receive the secure message and reply to the sender. So in this case, I'm going to log in as Dr. Winston and send a medical records request to Dr. Tom Smith. In this case, Dr. Tom Smith has not signed up on the network. But Dr. Winston works with Dr. Tom frequently, and so he has added Dr. Tom to his personal address book. As you can see, I'm going to send a message to his Gmail account. Once Dr. Tom Smith receives the message, he'll be prompted to log in, set his username and password, but he'll be able to receive his message right away and reply. So I'm going to log in to Dr. Tom Smith's Gmail account. And like the first example, you can see that Dr. Tom Smith has received a notification. But this time, when I click on the notification, Dr. Tom Smith will be prompted to set up his account for the first time. I'm going to go ahead and click Next. And now I'm going to set his password, add in his hint questions so he can easily retrieve his password if he should forget it in the future. And he'll set up his name. Now, once he sets up his name, he'll be able to log in and see the medical records request sent from Dr. Winston, as well as reply to that message. Unlike subscribers on the network, people that receive messages using the Send to Anyone feature can only reply to the original sender. So I'm going to show you how Dr. Tom can reply to the medical records request. And in this instance, Dr. Tom is going to go ahead and attach a chart summary, and it happens to be in the CCR format. So he's going to go ahead and reply to Dr. Winston, attach it, And like subscribers, he's able to preview the attachment before he sends it. In this case, it's a CCR. So I'm going to go ahead and send the message back to Dr. Winston. They are able to maintain two-way communication, with Dr. Tom able to reply to any messages he receives from Dr. Winston in the future. In this example, we saw how easy it was to communicate and send documents to anyone. They do not have to be a subscriber on the messaging portal. We showed how easy it was for someone to create their account and receive messages. Even if someone does not subscribe to the message portal, participants can still maintain two-way communication using the message portal. The AAFP Physicians Direct Clinical Messaging Portal offers a flexible communication channel regardless of status of the recipient. Finally, I'd like to show you some of the additional features of the Clinical Message Portal, including how to use the address book, create message templates, and access our live help system. I'm going to go ahead and log in as Dr. Winston. And in this case, I'm going to access the address book and show you that it's very easy to add other providers that you message with frequently or to manually create other entries. You can always import a list of providers from Outlook. You can also access the larger directory that includes a geographic search that lets you look for other providers or specialists in your area as well as nationally. In the next section, I'd like to show you how to create and send a message using a template. So I'm going to go ahead and start a new message. And in this example, I'm going to use placeholders. And I'm going to create a placeholder for the date. I'm going to add some text that can always be changed when sending a message using a template. And then I'm going to use a placeholder to end the sender's first name and last name to the message. Once I'm ready, I can go ahead and save the template, and for the purposes of this demonstration, I'm going to go ahead and name it template. And show you how easy it is once you've created a template to start a new message and select your message template, which again can always be edited. Lastly, I'd like to show you how easy it is to access inline help. Help is always available by clicking on the question mark in the upper right-hand corner. Live help is available by clicking on the link, and you can always chat live with Surescripts support. The portal is very user-friendly and functions like other web-based email systems. It has multiple built-in tools to become even more efficient, including online help. Live help is always only a click away. Hopefully you've seen how the Clinical Message Portal offers a very clean, straightforward way to improve patient care coordination. The Clinical Message Portal is a great way to create robust communication between your office and other members of your patient's care team. We also hope that you're discovering this is a great way to replace fax, mail, phone, and courier methods used to communicate with other practices locally and nationally across health systems, beyond EHR affiliation, and in a completely electronic and secure manner. And lastly, the Clinical Message Portal is a good solution to help you meet meaningful use objectives and earn EHR incentives. And now I'm going to turn things back to Matt.
Thanks, Sarah. Great job. And indeed, it looks like our audience is quite interested in everything the Clinical Message Portal can do. We've received lots of questions from our viewers, so let's jump right in so we can answer as many as possible.